Mental health is perception of problems. A lot of people think that, whatever is their problem is there's an impending doom feeling for them. The mental health issues are not addressed in India, are not accepted in India. So every corporate structure, everybody at the top is in some way harassing the person down. When you're not sleeping well, you'll have a lot of comfort food eating. Okay. So depression, obesity, sleep disorders are all connected. If you are not able to change habits, you can never change outcomes. I think with the way the world is going today, and we are living a digital life rather than a real life, So, but if suppose somebody has given a 3 star for a movie, okay, you may say कि okay, could be good, could be bad, but a 3 star for a service of a doctor or a hospital or anything, it is very different.
Hi, and welcome to another episode of Expert Talk with Bhavya Desai. Today we have once again Dr. Rajiv Kovil back on our podcast, but we're discussing mental health with him today. Now mental health, I think in today's day and age, is such an important thing. The reason is because there is a high chance that you or me could be suffering through some mental challenge or some mental health, and we would not even be aware of it. So in this podcast, we've tried to decode that. We've tried to understand that what are those factors that can lead to those sort of mental challenges. Also, how is it that you can identify? How is it that you can help? What is it that you need to do? Now, in many cases, when scenarios like these happen, also we are not aware of what needs to be done, what steps need to be taken. So we've talked about those things, and a lot of those things are not necessarily around mental health, because mental health is a very broad subject, but there are a lot of smaller factors which affect a human's mental health. So I hope you like this episode, because this was really interesting. When we were talking as well, I thought that there were many times when I was actually getting goosebumps as well. So if you like this one, then please, if you like our work, then do like, share and subscribe to our channel. Do leave a comment as well if there's any questions that you have, and see you in the next one. Hi, Dr. Kovil. Welcome back to another episode of Expert Talk with Bhavya Desai. I think the last time we spoke on diabetes, I think that episode was really good and very interesting, and there was some really good feedback about that as well. So I hope you enjoyed that conversation.
Oh, I enjoyed it every bit, and thank you so much for getting me back here on the couch with you, and hopefully we will have a much better conversation this time.
Absolutely. I'm really looking forward to it. Also, because this time I think as mentioned, I want to focus the conversation a little bit more about mental health. Of course, we will talk a little bit about diabetes as well and mental health related to that. But we touched upon that a little bit during that podcast. And that's why I thought that this is something which is very important from all perspectives. So that's the reason why if you want to say something, then and then.
So I think mental health broadly is cannot be very well defined, because it all depends on what affects you. So for somebody, it may be a buy not coming home, could be the end of the day or the doomsday for that person. And for somebody, the whole crashing of his economy or his whole interest may not be. So mental health is perception of problems, which there may be actually problems, but perception of those problems and what affects you mentally. So it can be very different for different people, and across the table, when we sit as clinicians or we sit as psychologists or psychiatrists, it's very difficult to actually find out what that person is going through, because for you it may be very trivial, an issue. But for that person who's going through that, it may be the end of the world for that person. So it's very important that when we discuss mental issues, especially with people with problems, there has to be a lot of empathy. You need to put yourself into that shoe and also understand the circumstances from where that person is coming up with. Because very easy to say that, oh, this is very simple, don't forget about it, just sleep over it and tomorrow will be a good day, But you need to actually have that empathy to understand that why is this person going through this? And is this a problem that I can resolve on my own? Do I need a team to resolve it? Can I speak to somebody else? So it's very important to identify that mental health issue for that person.
Right. But Is that difficult to do? The reason is because, see, as a doctor, when you're sitting on the other end of the table, you're obviously isolated in terms of what is happening in your circle of influence or what is happening in your mental state of mind. So, to put yourself in those shoes to try and understand what they might be going through, how does that
No,
happen?
I think it is not very difficult. It's not, you need to lead the patient, you need to do some cross questioning with the person, and you are able to come down to the crux of the problem. And it's not very difficult because a lot of people think that, whatever is their problem is, there's an impending doom feeling for them. That's why they open up. So most people do not open up to a doctor or to any other mental health specialist if it's a very small trivial problem.
Okay.
For you it may be trivial, but for the patient it could be a very big problem. But they open up only when the gravity of the problem is big enough to be spoken to somebody who can give them help. So once somebody is opening up to a problem, then that problem is not trivial.
Right.
Extremely important. If somebody is opening up to you for a personal problem, professional stress, whatever, or an illness related stress, then that problem is not trivial. So and first you have to listen to the patient. That's extremely important.
Right.
And only after listening to the patient, the circumstances the patient is coming through, then you can make an assessment that in what way you want to treat it. Is that person just going to require some assurance, some psychological assessment, or may also require some drug therapy and certain other support mechanisms.
Right. But does that recognition come a lot from patients, or do they really need to be shown through that path? Because I think as Indians, I feel that we are probably still not geared up because there is still a lot of, how do I say, there's still a lot of reservation when it comes to accepting that you might have a challenge in this way.
So Bhavya, it's important that whether the person or the patient has assessed himself or somebody has actually put that on him.
Okay.
Because very often what happens is that this uncle will be on a playground walking, and suddenly one auntie comes along and tells him कि आपका तो face पे सूजन लग रहा है, आपका kidney ठीक है कि नहीं.
Right.
So this guy for the next 1 month is now under stress that whether my kidneys are all right or not. And he will Google, he will go across everywhere on the digital media and find out whether swelling of face is linked to kidney problems. And you will have a lot of everyone answering, a lot of people answering, until he actually comes to the specialist or to his doctor, he's under the stress that he's undergoing a problem.
Right.
So the problem is that there's a lot of health related information which is available. There's a lot of what do you call it, misinformation and a greeting which is related to health. So if you meet a person after a long time, he may not ask you about your family, but he may say that Bhavya, you have lost weight,
Right.
or you have gained weight, or you have become darker, or your face looks swollen, or your eyes look droopy. These are very physical characteristics which we in our part of the world speak about.
Right.
And you are not actually telling the person anything more, but you are actually confusing that person. Because he feels there is something wrong. Oh, have I become dark?
Right.
Oh, have I gained weight? Oh, has my hair grayed a lot? Have I become older? So these are stresses which people go through on a daily basis. And they suddenly, somebody tells them that you have become dark, and tomorrow the guy is visiting a saloon.
Right.
He skipped work and went for a saloon visit because he felt that somebody called him dark.
Right.
So these are things these are also minor stresses which adds to already the pre-existing stress he's going through. So whether it's targets at work or profession or inter-relation problems or whatever it is, this adds to it. And if suppose he has an illness on top of it, and if it's a chronic illness like a hypertension or a heart disease or a diabetes, then it's added on to it. He suddenly feels that, oh, something is wrong.
Right. So this part which you spoke about, like the misinformation greetings as well, I have a little bit of I wanted a deeper understanding of it, and I want to come to that a little bit later. But what you mentioned about the chronic diseases right now, I think that's something which is pretty interesting because is there a definition for people who are obviously suffering or who are diagnosed with diabetes, and when it comes to mental health, is there some medical term for it, or is it just
So people with diabetes
Hmm.
also undergo something called diabetes distress.
Okay.
Okay, there's a very fine line between distress and depression.
Hmm.
Distress is where the disorder and the whole regimen that you need to follow for the disorder, whether it's diet, lifestyle, going to visits, going for your checkups, is disrupting your day-to-day schedule.
Right.
Okay, and what exactly is depression is just failure to enjoy life. Everything is all right in your life. There's nothing drastically wrong, but you're not liking anything of it, and that is depression. So there's a very fine line. So sometimes failure to enjoy life can be occurring because of the stresses that one takes because of the disorder.
Right.
Or sometimes the disorder has caused so many comorbidities or complications that the patient does feel that there is impending doom happening.
Okay.
So for us, we have to assess that whether he has so many problems that, or he is overestimating his problems.
Understand.
And if he's overestimating, it is the doctor's prerogative to make him understand the problems. And make him go through the road that these are problems which can have a resolution also.
Understand.
Rather than him pointing out those problems and realizing now nothing is going to change, and now it's only downhill from tomorrow onwards.
Understand.
So that needs to be gauged on a patient to patient basis. And majority of the people with diabetes do have distress and depression.
Okay.
Because once you get this diagnosis, people feel that my lifespan is curtailed. I need to do everything in a short span of time.
Right.
And tomorrow may not be available for me, whether I want to do it for my family, for myself, for my savings, for my whatever it is. But that feeling comes into people.
Okay.
And it's very difficult for them to actually acknowledge it. But everybody goes through that.
Right. But is this something which usually happens with people who are diagnosed with diabetes after a particular age, or is it generally possible for someone who's at any age?
Very good question, Bhavya. So it all depends upon if it's age related, younger the person, more anxious he is. Okay. Sometimes he's very frustrated. He's frustrated, probably he blames his genes for it, or he blames his lifestyle for it, but whatever the damage is done.
Right.
Okay. In the senior age groups, many a time you have issues, you have complications. So either there has been, these complications have not been addressed properly, or the patient has reached an end stage of those complications and is going to bear the brunt of the problem. So we have to realize in this whole cycle, where is he placed right now? Right. And then give him counseling accordingly. So it can go from anxiety, frustration, denial, to actually a person having a lot of complications and feeling depressed about it.
Okay. So, but what are the similarities of then a clinical depression versus someone who has this diabetes distress disorder?
Very difficult to actually dissect that. Very, very difficult. So when you realize that the person's life and lifestyle is completely disrupted, whether it's because of his mental health, or whether because of diabetes and its complications, or any other chronic disorder. It could be heart failure, for example. It could be cancer, for example. It could be severe lung disease, for example. Then apart from counseling, you have to give them pharmacotherapy. We have to relieve and give a better quality of life to that patient.
Right.
So the diabetes distress per se may not require a drug therapy, but depression with diabetes will show, but it's very difficult to do that. And acceptability or acceptance of the problem by the patient is even more difficult. So first the person has to accept that there is a problem. Okay, my life is disrupted because of all this. I need to take help. And then most of the people don't want to take drug therapy for this.
Right.
So first you have to handhold them initially to actually accept the problem. After acceptance, we have to gauge what is the level of clinical depression or distress you are having, and then go ahead and treat them. So whether treatment is just psychological or with pharmacotherapy will depend.
But why the resistance from a patient? Because at the end of the day, it is obviously going to be something which is going to be good for them, right? Or is it just acceptance in general?
Acceptance in general, Bhavya, because if you, just giving you an example is that I am a diabetologist and for the last 25 years, there's a file made for each patient.
Right.
Patient goes out with a file. Have you ever seen a psychiatrist file in your life? You'll never come across a file from a psychiatrist. There are a few psychiatrists who make files, but the patient tears it off or throws it the time he walks out of the cabin. He doesn't want to be identified with a mental health problem.
Right.
So the acceptance or denial is there. Even if he visits somebody, he will just carry a paper which is folded into his pocket. Okay? He doesn't want to be identified. So that is where the problem is. That nobody, because in our population means if you're going to a psychiatrist or a psychologist, so pagal hai. That is the social stigma associated with it. So that's the reason that people are reluctant to take help. And people will call us up and ask us that I don't want to meet a psychiatrist, I want to meet a psychologist. So I said, let the psychiatrist or the mental health expert decide that whether you need a psychologist or you need therapy or you need both. No, I want to meet a psychologist. I want to discuss my problem. I said, fine, discuss your problem, but let the doctor decide on that.
Right.
So that's where the mental health issues are not addressed in India, are not accepted in India as compared to the West, where it's very well addressed, where people seek help, and people who seek help are also given a lot of help by people who are around them.
Right.
Which is very unlike India. If you are depressed, you are left on your own. Nobody is giving you help, nobody is giving you a helping hand, nobody is lending you support. And finally you see that you are a social recluse and nobody is ready to help you.
Very interesting in terms of social stigma. But before that, what is the difference between a psychiatrist and a psychologist? What do they do?
Okay, good question. Psychiatrist is a person who is a medical doctor trained in psychiatry. Okay. He also has studied psychology as a subject in his psychiatry.
Okay.
Psychologist can be a psychiatrist also, but you also have psychologist as a degree, which is BSc and MSc psychology.
Okay.
And BA and MA psychology also. So a psychologist may not be a doctor, can be a doctor if it's a PhD doctor. A psychiatrist is a doctor and can practice psychology also. Or he obviously practice, and most of us also in chronic care, like we could write the prescription in a minute. Your 15-minute with the patient is about convincing them, about talking to them about their problem, which is a part of psychology.
Right.
Making them adherent to the problem, making them accept the problem, making them see the problem, making them realize what lifestyle mistakes are they making. So that also is psychology. That's all psychotherapy.
Right.
So writing a prescription is very easy. In a chronic care, adherence to the problem, adherence to the medication, adherence to lifestyle can come only when you are able to impress him psychologically. If you're able to, motivate him to a level, because he could just go out and say कि डॉक्टर का काम था ये सब बोलना, मेरे को कुछ नहीं खाना है. डॉक्टर ऐसे ही पैसे लेने के लिए सब बोल देता है. 10 दवा लिख के दिया, मेरे को 2 ही लेना है. I wanted lesser medicine. So this is the usual thing. People will say, I want lesser medicines, I want lesser doctor visits, I want lesser tests to be done. But every patient wants the best of health.
Right.
So that there is a process in it. There's a process involved in it. So if you have to make a person accept and adhere to any therapy for that matter, not just taking medications, but just any therapy, you have to motivate that person. And what kind of changes can happen when you do that therapy? What is our end game? What do we expect after 6 months, a year? So a plan has to be given to him.
Right.
He's not going to accept a treatment saying that, oh, doctor's written it, he's God and I'm going to take that treatment. So you have to give him a plan that this will work and then I could reduce a few things for you, and if you do this, maybe we could do this. So that plan needs to be, so then the person feels that, okay,
Yeah.
I am in the right hand, there is a plan in place. Let me go according to the plan.
I think it's also very relevant in this case sort of a scenario, right? For example, in this, how do I say, this line of doctory, if you call that a word, the reason is because in a lot of the other forms or other practices, you usually have a line where you actually have, you diagnose the symptoms, and then you have, of course, the stages of medical treatment that you can provide. But when it comes to mental health, then it, because mind is just such a wide access.
Absolutely. So in 2019, there's a paper by the WHO
Huh.
which talks about using art and art therapy as treatment for prevention of ill health and also treatment of ill health.
Okay.
And especially in palliative care, like you have a cancer, you have a end stage problem, a person undergoing a major surgery, and how it has a huge impact on mental health. So a perception of pain following chemotherapy or any other surgery is completely alleviated when you use any kind of art therapy. Okay, and we have been working on it for the last 2.5 years. You are aware of it. That and our whole endeavor is in the next few years. Like I prescribe that you go for an exercise and you take an 1800 calorie diet and you take these medicines 3 times a day. Also, I prescribe an art therapy for you. And I am just not prescribing an art therapy because I like it. Because there's evidence to suggest that probably this art therapy is going to help you. So it could be a visual art, it could be singing art, it could be something which you do, and that is going to help you. And there's evidence to suggest that this will help you.
Right.
In everything, whether prevention and the majority of help is in mental health. So recently, patients with depression, with clinical depression, in France, in Paris, they have started taking them out for museum visits for the last 2 years. And what they have seen is that people who go for museum visits do much better in their adherence to problems and their problems as compared to people who don't do museum visits. So that monthly museum visits has helped them. So they see a lot of things, they explore a lot more, they meet a lot more people, and that's changed their behavior.
So is it like that? Then it equates to any individual having any sort of a any sort of time or any sort of activity which really relaxes them. Like for example, now I know that you might know that there are a lot of conversations where there was this meme which came about like the boys' time, you know. Once in a month, if you just let the boys get out and just have like a drink with their friends and just have like boy time. Similar like that, there is for women like shopping or whatever. So are those activities which also tend to relax an individual if they are going through that?
See, it all depends on see, sometimes these activities are also addictive activities. So if it's more often, it is addictive.
Okay.
Okay. Like for example, completely different end of the spectrum. I have a neighbor who used to suffer from chronic lung disease. Okay. And she was admitted 3-4 times in a year with lung problems, you know, and she always used to be on oxygen and stuff like that. Last 5 years, she's taken up singing in a real big way. So she organizes singing classes at her home. So you have every day morning somebody singing for the next 3 to 4 hours morning, 3 to 4 hours evening. So in a casual conversation, she told me that after singing, her lungs have opened up. Singing is what? You know, singing is an exercise for your lung. After she started singing, her lungs have opened up. There's no more hospitalization. She's able to breathe well. Her oxygen requirements have gone down. She's feeling very, very well. And she said, I have not changed anything other than my singing. So, you know, if this kind of an exercise, if you tell somebody, you say, okay, what are you talking about? I have a lung problem, you're telling me to sing. You know, so this is a direct where your lungs are getting an exercise. But there are a lot of other habits, like you said, that, you know, if you have to just go out for like once a month and it completely helps you, you know, put a clean slate on what has happened at work or wherever, obviously do it. Obviously do it. Because what are you living life for? You're living life for a good quality of life. It's not the time spent here.
Right.
And whatever improves your quality of life, whatever, and if that quality of life improves your interpersonal, your professional relationships, fantastic. Go ahead and do it.
Right. I want to take you back about what you were saying earlier about how internationally people don't view things in a specific manner, and in India per se, how people still kind of think that, okay, what, maybe if I have a prescription or a file from a psychiatrist, then it might be a little difficult. But do you think that mentality is changing now in more of the recent times or in the recent years?
Mentality is not changing. People are seeking the psychologist or psychiatrist when they are in a problem.
Okay.
They are not seeking it earlier to prevent a problem. That's where the problem. So every corporate structure, everybody at the top is in some way harassing the person down, in whichever way is happening. And there is a pressure. There is a pressure for work. Okay. Now somewhere in that line, somebody is feeling depressed.
Right.
He's not seeking opinion.
Right.
He's not seeking anything, and that's where the problem lies. That you are not very empathetic towards that person, which is unlike the West. Where you do not have so many, the working hours, work from home. So whether you are working in office or working from home, the work number of hours put in is much higher. So there is a lot of pressure on every individual to perform and to show his performance, and that is interlinked to his mental health. While in the West, that if you tell that you are in a poor mental health, it's taken very, very seriously. They will give you all the possible support to make sure that nothing happens. So employee safety or employee mental health is taken in a very, very serious way in the world. While it is there in their HR policies everywhere, but it's not so serious.
Right.
You bombard work to your subordinates and you expect them to perform. When you don't give them enough amount of time or enough amount of resources to make that performance happen.
I understand.
Right. So that will obviously lead to some amount of anxiety, frustration, depression, anxiety. All these things will come in, which will lead to wrong behaviors, which will lead to some illness. So it's a chronic cycle.
What are the symptoms of depression? If you can, highlight it down in probably like 4 or 5 of them.
So the simple definition, as I told you earlier, is failure to enjoy life.
Right.
If you're just not liking anything about what you're doing, is depression. Is depression for the world, is depression for us. If you're not happy with what you're doing, is depression.
Okay.
It need not be that you have to sit down in a corner and cry, or you have to shut yourself in a room and do something. It doesn't mean those are behaviors you try to overcome the problem.
Okay.
You are just not feeling right about what you are doing or where you are, is depression. And that needs help, because you're going to eventually take it out somewhere.
Right.
So that needs help, and that is very difficult for a person to come out and say. Very difficult. So whether it's in a marriage, whether it's in a profession, it's very difficult for him to say, "Oh, I'm not liking this." It takes a lot of guts from that individual to say, "Oh, I was born to be a painter. I cannot do this executive job of selling soap every corner, so I am leaving this." Not going to happen.
But what are the extreme steps then somebody who's suffering through depression or these challenges can they take?
So chronically, you can, obviously your sleep disorders will come in. You are not able to sleep well. When you're not sleeping well, you will have a lot of comfort food eating. Okay. So depression, obesity, sleep disorders are all connected. Okay. So chronically you can get all these problems. So once you get into comfort eating, which majority of people who are depressed do, so food and palatability of food becomes a luxury for them, so they start eating wrong. You can end up with problems. Acutely, you can do self-harm, which is very which is something that one needs to diagnose. That's why I said that we can never make the issue very trivial, because for that person, whatever it is, who could be very, very drastic for him, could be very dangerous for him. So we need to speak to him. So for you, it may be very trivial issue, but for him, it may be to the extent that he can do self harm or cause a harm to somebody else. So that's something we need to, and if that is something that we can assess, then a person needs to be under a psychiatrist. Then, if you see that whatever be the cause, doesn't matter what the cause is, but he is at an extreme to do something wrong to himself, then it should be. So that's why there's so many young people who do a lot of wrong things because they are depressed. Now, whether it's peer pressure, whether it's something else, we need to identify that.
Getting goosebumps. uh, you know, interesting what you say about what they can do. And you mentioned that the biggest and the most important thing that somebody needs to do is empathy, right? Show empathy towards them because you need a listening ear. What are the other things that people around them should do? Like, I know it is difficult because I think for an individual as well, it'll be difficult to understand and recognize that yes, this person might be depressed. Say, for example, if it's family, okay, if there's somebody that I know might be depressed, but I don't know whether they are because I don't know, I'm not a doctor, I can't see the symptoms. So in a case like that, then how do you?
From the close family,
Huh.
any abnormal behavior,
Hmm.
from the person whom you have known well, you should consider it to be, unless you have,
Okay.
you have done some test and there's no organic cause for it, then you should consider depression. Somebody was an extrovert suddenly stops speaking to people, or somebody was an introvert suddenly starts doing something different. So you see a behavioral change in a person, you should consider there is some mental health issues. It may not be depression. There are so many other mental health issues also. So if there is a change in the person's behavior, which you can identify, means people at home can easily identify, and many people at home, even if you identify whether it's a depression or patient has schizophrenia or a bipolar disorder, the person feels that if I am taking this patient to the doctor, I have done my duty. It doesn't end there. It will never end there. So you need to go to the core and probably speak to that person about it. What is the trigger point? And many a time there are trigger points for people, and it could be circumstances which are trigger points. So if you don't lead them to those circumstances, there may not be trigger points for them. So
Sorry.
So these trigger points can only be identified by the person or the people who are very close to that person. It could be a very foolish trigger point, but it is triggering that person.
Right. But are traumas also mental traumas? Like, for example, they say that there's something that you possibly might have viewed and things like that, or something you might have seen in your family between your parents and XYZ. Those play also a very
Absolutely,
important part into.
they play a huge part into all this. Huge part into all this. What you have witnessed, whether it's good or bad, they will have their imprint on you when you grow up. And if suppose you have this chronically happening, you may just consider that this being normal. Like for example, if there's an abuse happening and nobody is complaining about it, you may just think this is normal behavior of people. So it's important that you go into this history, and this history is very difficult in Indian scenarios to sit down with somebody and go through this history unless the person is ready to open up. It's very, very difficult. So you'll have a small percentage of people who will come out and open up about their trauma.
Right.
So unless it's a physical trauma, they have seen some death, some tragic things happening in there,
Right.
Which they may open up. But something else,
Right.
psychological trauma, very, very difficult.
Understand. But are men and women viewed differently when it comes to mental challenges or depression? Like, for example, men are usually considered to be a little bit more macho, they're supposed to be a little bit more strong. So they kind of resist as much as possible. Is it like that, where they're viewed a lot differently from both, from an outsider's perspective or in general as well?
The depression between men and women is almost the same.
Okay.
And men being macho and all is a perception which is being given. Sometimes it's the man who's undergoing more depression than many other people, and he's silently, just adjusting to the pressures of it. So men can take care of everything, and men is the, is going to guard the whole family. Is a myth of the old. It's broken now. So there are a lot more stronger women than men are, and I believe that women can handle a lot more these kind of psychological issues than what men can do.
Okay.
So men are more vulnerable to these problems, and so for men, pressures are also multifocal as compared to probably women. But women are, I think, better accustomed or equipped to handle a lot more mental health issues as compared to men. So men who end up physically abusing their health obviously are doing it because of something else. I wouldn't say all of them. Few of them, a majority, are doing it for enjoyment purposes, but there are a lot of people who are doing, whether it's a substance or anything, because they want to forget what is happening.
Okay. Very interesting you talk about this actually, because this like habit formation is something that I also wanted to discuss about. For example, so that means men or women per se, do they like end up drinking or smoking a lot more if they are depressed?
Yes. So substance abuse is much higher when you are depressed. Absolutely much higher. Which doesn't mean that if you're depressed you should do that. It's not that depression will link you to. But then you're depressed and you're seeking anything which can just alleviate you or relieve your symptoms for a short period of time. And that's where these substances do come in, and people abuse them there, and probably there is where you need a helping hand. And habits, yes. So habits are formed by a lot of things, what you see, what you observe, what you are doing at home. And if you are not able to change habits, you can never change outcomes. So habit is the biggest, I would say, I think there should be a habit forming doctor or a degree for that, because these are things which we need to change. Because if somebody at home is smoking or is drinking, and a child at 4-year-old is seeing that, he doesn't think it's anything wrong. And I'm not saying drinking at home is wrong or smoking at home.
Right.
I'm nobody to make that. But if you want your child not to smoke or not to drink, then you better not do it in front of him. And an open conversation with a growing adult is very, very important, which usually doesn't occur. It occurs in metro cities, but otherwise it doesn't occur. So habits are usually derived from peer pressure, and that's where the habits are wrong, and that's where you are almost competing with people, and you are looked down upon if you don't do something, and that's where it all starts, and then you end up in
Right.
problems.
Right. So this about the younger people and that conversation is something that I want to get to next. But before that, how do you differentiate about what you're doing is for enjoyment and what is not for for depression? Like for example, I'll just give you an example. Now I am a person who actually enjoys the occasional tipple, yeah, and I really like it and I do it because I enjoy it. For many people, including my wife as well, they will like, okay, is everything okay? Why are you drinking so much? But so how do you? How,
So if it is an addictive behavior,
okay.
okay, then it's a problem. And you may not be addicted to whatever is the behavior, but there are people who wake up, look forward to that, plan for that behavior. So whether it's tobacco, alcohol, substance, your day is going in planning for that.
Okay.
So whether it's daily or alternate day or third day, you are planning it. That is addictive behavior. Okay, as compared to something which you're doing to give you a relief for a short period of time or just to make you feel better that's not addictive. So social drinking or social, I wouldn't say social substance in any form is wrong, but social drinking is not a problem. tobacco has its own ill effects. We are not here to talk about ill effects of tobacco, but tobacco has its own ill effects. So social or addictive tobacco is a no, and tobacco is the biggest addiction in the world. It's much higher than anything. But unfortunately, in India, alcohol is considered a taboo when tobacco is not considered a taboo. That's a cultural problem for us. We need to make sure that how in the Western world people who smoke are considered trash and people who drink are not considered trash. That should be a customary change which we need to make. So these are things that we need to identify. So if there are people who are drinking daily or are doing anything on a daily basis or very regular basis, that is addictive behavior. So there are people who never go home directly. Their route is through a bar. There are people who drive home and sit in their parking and drink and go up. There are people. I mean, these are people who are not allowed to drink at home. There are people who reach home and drink and then only speak to their other people of the family. So they are losing a lot on family life which they don't understand. And that is a huge problem in India.
And that is a clearest sign of somebody clinically depressed. for sure.
Absolutely. That is a sign of addictive behavior, and there could be now. Obviously, that person who is doing it will have his own rationale for doing it. Okay, when one who is doing it, it will be very difficult to reason out with him to come and seek help. So majority of the time, people who drink seek help only when there is a chronic liver problem, and by that time, damage has already happened. You know.
Now, I wanted to talk about this peer pressure that you were saying, especially when it comes to younger generation. Are you seeing a lot more of the younger generation now starting to move towards therapy and things like that to address with a lot of the mental challenges that they might have?
I think with the way the world is going today, and we are living a digital life rather than a real life, or maybe an Instagrammable life rather than a real life, and the way it is leading, I think there's a lot of peer pressure on young people to have Instagram stories and Instagrammable occasions and events in their life than actual real events, and that's a huge problem. So social media is killing your natural instincts in life. And that I don't know how it will lead to what, I don't know. And today, just taking a little vacation from what you spoke about, patients today are far different from patients when I started 25 years back. We didn't have the digital media at all then. We hardly had cell phones then. Cell phones was just coming in, and only the elite like you could afford a cell phone then. But today we call it as the idiot syndrome.
Yes.
Internet derived information obstructing treatment, and it is real. And it is real. It is real on a daily basis with a few people. People will ask you, sir, are you sure? And the people who are asking you are the young breed. Sometimes the young breed who was accompanying the older breed, or the young breed are people with diabetes or other chronic problems. So are you sure? The internet says this. So there's a lot of unscreened information out there, which is confusing people. And medical science is not a linear science. It's never going to be linear. And a doctor takes at least 10 years to understand it. And for the rest of his life, he's still a student. He's still learning. And things keep changing. So it's not linear at all. It's not like mathematics at all. So you can have, and that's the beauty of science, is that you can have different schools of thought, and none of them may be wrong, but it's your rationale which will tell you that which is the right step to take.
Right.
So internet can never be a solution for this. Similarly, when we come back to the younger people, they already have a particular frame made in their mind for themselves. Right. Okay, and when they come to a doctor seeking any kind of opinion, they are already in their already made up the diagnosis. So they come to you and give the diagnosis, and they expect you to just confirm the diagnosis and give treatment. You don't have to diagnose me. I have diagnosed. I have this problem. So we have so many youngsters who come and tell me, "Ki, sir, I have erectile dysfunction." So I said, "How old are you?" I said, 25. I said, "What makes you feel?" And then when you hear them that they've been bombarded with so many things on the media, on the internet, they see so many sites and so many things. They have a complete different thought process. I said, "You have nothing. There's just a psychological problem. Go back, you have nothing. Go back, live your life." So there are so many people who are going the wrong way because of the bombardment of information, and also the whole thing of looking cool. So people end up doing a lot of stuff which they otherwise wouldn't be. If there was no social media, they may not have been doing all these things which they are doing. Life would have been much easier, like life was easier 25 years back.
Right.
Would have been easier, and today it's not easy because so many things are there and they can get information from everywhere. So nobody is going to a library today. It's a digital library. Nobody has opened an encyclopedia. Nobody has opened an atlas. You have everything on so you have everything out there. You ask a question to a Google Mini and it answers you everything. You don't have to write. You have Chat GPT which gives you information. So the whole life has changed today. So
especially because there is the filtration in terms of what is good and what is bad information. There is absolutely no filtration because the internet actually throws up everything at you.
So what happens is that if you have a new movie released, you will go on the review and see, how many, or if you're going to a restaurant, you may just review that. But medical science is not like that. You cannot go on a review. You may go down word of mouth of people, So, but if suppose somebody has given a 3-star for a movie, okay, you may say, okay, could be good, could be bad, but a 3-star for a service of a doctor or a hospital or anything, it is very different because probably the communication may not be there, but everything is up to that. You are looking at everything there on the internet and then making your own opinion about it. That is not something which is good.
This is very interesting because there's an anecdote that I have, and which was about the misinformation bit that we are talking about. So I recently learned this, that one of my team members, he actually Googled some information a while back, and his nails were turning a little dark. So he read somewhere online in one of the articles, probably one of the first few links, that this is a very high chance of diabetes, or there's also a very high chance of cancer, whatever it might be, a really big chronic disease. And I'm told that for the next couple of days, he was so stressed that he really kind of went into his shell a little bit and things like that. And then other team members actually had to kind of just look it up, things like that, and tell them that, look, this is not the case. This is just basically a calcium deficiency,
So Bhavya, you're right. See, today's patient doesn't come and give us symptoms. Comes and gives us diagnosis. Patients 30 years back, 35 years back would come and give symptoms. That I am probably having cough, I am having burning in my urine. Today's patient will come and say, I have a pneumonia, I have a urinary tract infection,
Right.
I have a viral infection. So give me medicines for it. So it has changed. Who told you have a pneumonia? What is urinary tract infection? Just burning in your urine is urinary tract infection. So the world has changed. So there's a huge need for us to have a lot more literacy about all this, and majority of mental health issues also come in because people read all these things without actually dissecting, deciphering what is required. What do I fit? So ideally you should never be doing it. You should go as a clean slate, give your history to your healthcare doctor, and then if you trust, and I think you should trust your doctor, go back. A lot of people take 5 opinions because in medical science you can have 5 different opinions. And like we have had patients who take 10 opinions for a cataract, out of which 5 said you should operate, 5 said you can wait. Now who's right? Whether the 5 who said you should operate is right, or 5 who said you should wait for 6 months is right. It's a cataract. You decide when to operate depends on how your vision is. But people do this. So in my opinion, a second opinion should be ideally, you should speak to your doctor about it, and maybe your doctor should tell you that, you should take a second opinion. Second opinions should not be taken because it confuses the patient. And it's a normal, because it's an out of pocket for patients. Patients feel that I can take multiple opinions, and whichever opinion suits them is the right opinion. That further confuses the person.
Right, right. But from a perspective you know, uh, about like the younger generation, how they actually deal with mental health. The reason is I ask is because I think a lot of parents, who have like young daughters and sons and stuff like that. I know people who actually their children go for therapy. I mean, as young as like 20, 20 months and like maybe 19s. And that to me is a little surprising. Maybe a certain amount of it is, of course, the social stigma as well, which we've kind of come down to think of it, as you mentioned earlier. But is it important for parents to keep a track of these things about how the mental well-being is of their children? And how do they do that?
No, it is important because the kind of pressure which a child goes through today, even a 4-year-old, 5-year-old, you have an assessment for all of them. Ideally should not be there. Children should grow up till they are 10, 12, 11 without giving any examinations all through. That pressure of a hurdle makes you push them to do things, and that becomes a behavior for people. And obviously you have a ranking, and if you're not there on the ranking there, then obviously you're not good. So that obviously will work on the patient's, on the child's psyche when he grows up. So these are things which, and I think as a parent is very, very important. Very, very important, because even today every school is competitive. And it doesn't mean that a child who ranks well in school will do well in life. And I think that kind of education needs to change, and I don't think you and me can change that. But education needs to change, because we don't need to learn about, like I've always said that we need to learn about nutrition in school. I don't need to learn about how the forest looks, or if I'm interested, yes, but I don't need to learn about a lot of fighters who were there 5 years, 500 years back. I would like to learn about, when I come out, what is the kind of nutrition. If I'm a biological student, I should learn about nutrition. I should learn about what is happening in my body. If I want to follow geography, I should learn about all these things. But otherwise, the other kinds of history has no value for us. So education needs to be changed. Education needs to be more hands-on. Education needs to be practical. Education needs to be graded rather than ranked. So those are things which cannot happen overnight. Until that doesn't happen, there is going to be peer pressure on children, and children are graded based on how you perform scholastically only. So you're dumb or intelligent is based on your rank. The person who's the backbencher and probably the last in rank may be the most intelligent guy, but you have not assessed him there.
But is that just generally the innate way that the world is moving? Because if you see from what it was about like 20, 25 years back of what you were saying, then to what it is now, wherein you obviously things have migrated, there's so much of information, there's so much of information at disposal, because for the better part of a better future, you are actually putting a lot more pressure in terms of everything, for a better quality of life, for a better societal mindset or perception of who you should be 10 years down the line, maybe when you grow up. Is that because, of course, all of this definitely adds to the mental stress that any child goes through. But is that the direction, and are all of us guilty of that?
We are all guilty of that. And there's no way you can change the structure, because you are all in that rat race only. So unless there's a complete change in our education habits or in education structure, nothing will change. So you have these hurdles, and probably those those whatever you call them, 10th, 12th, all those hurdles need to be much more easier and much more, and it cannot be just based on your marks there. And that needs to change, because a student who's not scoring well doesn't mean that he is a failure in life. His skills could have been somewhere else. We have not seen that. Which we have not seen, because we are actually considering him as an academic person only, that he will be good in academics only.
Right. How early do you think that children these days develop a lot of the depression or mental disorders in terms of age?
Though I'm not an expert, but a lot of children today undergo attention deficit disorders. Very, very common. They just, because there's so much bombardment. They are given so much of information. Also, they see so many things. They are not attentive on anything for it's just a few seconds. So ADD is very high, and ADHD is also very high, where you have a hyperactive child. And those are things which a mother can only identify. And in India, it's very important that you identify. Many a time you feel that the child is he's not interested, he's lazy. Those are but ADD is very high. And whether it progresses towards anxiety and depression in adulthood, difficult to say. But attention deficit disorder is very, very high in children. Right. And that's something which we need to identify. And the mother can identify, and a psychologist and a child psychiatrist can really help there.
Right.
And then there are children which you can obviously identify if there is aggression from a child for no apparent reason. Then these are things which you can identify with. But ADD and ADHD, very, very common, and this needs to be identified in the children.
Right. From a perspective of adults, you mentioned earlier, and when you said about this, then it actually brought back like one question in my head, is that you mentioned the treatment in terms of prescription for, and correct me if I'm wrong, prescription in terms of treatment for someone who's having any depression or wants to visit a psychiatrist or a psychologist, there is a lot of reluctant, and they don't want to take that line of treatment. Am I understanding that correctly?
You end up going to a psychiatrist only when your symptoms have gone ahead and is either causing harm to yourself or to others around.
Right.
You are not seeking treatment earlier. That's where the problem is.
Okay.
Problem is that unless others or you have gone to a complete end of the spectrum where you're causing damage to you, you're not seeking treatment. And that's because there's a taboo. There's a taboo that, he's going to a psychiatrist.
Right.
And there's a taboo across. And that's something that we need to address, because mental health is not a taboo. People have mental health issues and they come out of it very, very well. And you need to be much more empathetic towards them. So coping disorders, so many of them are mental health issues. And you may just find a different way of coping with that problem. So if you are able to identify, it will help. But it never happens. So unless you have symptoms which are there at your face, which you can't ignore, patients are not seeking treatment.
Right. There's this social media that you spoke about, of course. So technology is naturally linked to that. Right? And whenever we obviously have technology, it is advanced so much that there is so many things that you can use today to identify things. Like, for example, gadgets or smart devices are one of them. Do you think that they help in a manner, or they actually add to the to adding more stress to an individual?
See, it's like this, technology is a double-edged sword. It all depends on. Now, if sometimes you say, why are you using artificial intelligence is it when you don't have natural intelligence? So, if you use it correctly, obviously it makes a lot of difference. So, if you use your smartwatch for just tracking your heartbeat, your exercise schedules, your sleeping patterns, and if you can change some things with it, very, very good.
Right.
Very, very good. But if you're not using it and you're using it for deriving a lot of information and doing so many other activities, it may not be helpful for you. So it all depends on how well you use the app, and importantly, all these apps have to have some approval. Majority of the apps which are there, which you can download, okay, would give you any kind of things out of it. Somebody could just keep something here and tell you you have XYZ. So it's very important to realize ki where is it approved. It has to be approved in all the top countries of the world or the top associations of the world to be used as a medical device.
Right.
If you're using it as a medical device, then it has to have an approval. You just cannot use anything. So that is number one. So a lot of people use a lot of apps. Like for us, we have the continuous glucose monitoring system. And you put a patch and you're able to see how the blood sugar swings. It's very, very good for people with diabetes, pre-diabetes, people who are on insulin. But it's not good for people who do not have any of this. A lot of people, a normal person also puts a patch today just to find out what triggers the sugar. That's foolish to be doing. Unless you have a blood sugar issue, okay, putting that makes sense. If you do not have a blood sugar issue, putting a CGM doesn't make sense.
Right.
And 25 to 30% of users who are using it in India do not have a blood sugar issue.
Right.
They're using it as a fad, just to see that if I have 5 ice creams, does my sugar rise? It's like if I run, does my heart rate go up? It will. It will. If you run at a fast speed, your heart rate will go up. That's a natural response of the body. There's nothing wrong in it. So you have to use technology also, right? So you have to integrate technology. You have to make sure that the technology has an approval from the right authorities, and you use it right for your purposes. It will.
But do these things create more anxiety amongst people? Because there are also people who, like you said, they actually use it and they take it a lot more seriously than what they actually should.
That's what I said. It's a double-edged sword. So if you are able to use the technology for betterment of your health, it's a win-win situation. If you're going to use it and make worse of your mental health, it's not worth doing. It's not worth it at all, because what is happening today is that there's so much consumption of even media and so many things happening that you are not able to connect to the real world at all, because you are in a digital space all through, and there are people who are working from home also all through, so they are not connected to the external environment, and then all these stresses come in. So a person who just gets a sore throat feels there's a major problem on him. A person feels he has a thyroid problem. Person who gets a little change in his voice feels that there's some nodules on his vocal cords. So these are things which occur with people. So it's extremely important that if you are using an app, okay, and it's going to add to your mental problems, then do not use the app. And all these apps can be used for risk scoring. Okay. And if you are able to connect with your doctor, most of us today we are not good technologists, but today we have graduated a little and we know a little bit more about technology. So there are a lot of apps which can be connected, with the doctor, with this software, and you can do a lot of risk scoring. And that is an evolved person. That's an evolved patient. That's a wonderful patient to have. If we can, track his habits, track his vitals like his pulse, blood pressure, his sleeping habits, his food habits. There are a lot of apps where you can integrate this, and he can tell me that in the last 6 months, this is what I have done, and this is what it has helped. Fantastic. That's a very evolved person, and he can be a good ambassador for these apps and their proper usage. But there could be another person who just feels that there's disordered sleep, and he doesn't sleep further because of the disordered sleep, and he's not analyzing it, nor is he talking to the doctor. That becomes a problem area. And that is what sometimes many people do. Many people do not analyze these things, they look at it as a snapshot. They are not able to. So if you are on a CGM and if you see your sugar rise, you are looking at that snapshot. My sugar rose because of X, but you are not looking at what happened around. So that discussion needs to be there.
Right.
That so app is good, but app with human intervention is even better.
Got it. You mentioned that, of course, like if something like this needs to be taken extremely seriously, then it needs to have approvals. Now, to get those sort of approvals, naturally, it is a lot amount of investments from any of these tech companies. Whether it's a wearable, whether it's Apple, Samsung, so on. And naturally, they are not going to go that course because they would obviously feel that it is something that the pharmaceutical companies, whoever, basically, they are the ones who are actually need to do any of these things. Then, do you ever see any of them actually?
No, but actually you're wrong. All these companies which you spoke about are going that route. They are looking for an approval. They are looking, and all these devices, if they are going to be used for medical reasoning, if you're using it as a fad, as a seasonal fad, and I want to see what happens, then it's a completely different issue. If you're going to use it as a medical device, okay, even a wearable which measures your blood pressure, there are a lot of them, and it needs to have a medical approval, and everybody is going that route.
Is it?
Yes, everybody is getting approval also on lot of devices, and there are lot of devices which also help, which will help us. So there are devices which will track patients. There are devices which will also tell us whether we are giving the proper guideline directed management to that patient, and how are they benefiting. So the apps are on both sides, for the consumer and for the doctors as well, to see how they are doing, and they are all approved devices, and this will actually help the end consumer, which is the patient. So if you don't use approved devices, you're going to have false, erroneous readings, and how do you interpret them?
Right. So, but are these like fast-moving consumer
These
devices?
are fast moving. These are
like
fast.
your watches and
Absolutely fast moving. Absolutely fast. So you will have a lot of interconnected wearable devices which are approved and which can be used.
like some popular ones.
So your your Apple Watch is one of them. Which we.
I thought it was not.
No, it is. It is. So it gives you a rhythm. Okay, the Apple Watch in some countries is connected to their emergency. Also, so if there's a rhythm, it directly calls up your emergency contact, and it also gives an emergency to the ER. So that's a huge change. Okay, you have variable for us sugars, which gives us alarms to whoever you want. You can have 4 to 5 alarms to people around you. So if there are young children with diabetes and whose sugars are going down or up, there'll be alarms given to people and these are all approved devices. You have so many cardio defibrillators, as we call it, ICDs, which can give alarms to people, which can give alarm on the watch, which can give alarms to people. So these devices have gone far ahead in treatment as such, and it is going to further go ahead only, and all of them are going in the right direction, and they will be used rightly, and I don't see a future where technology will be misused. Technology will be misused only where people can buy technology.
What does that mean? I mean,
see, if you are able to buy technology here in our country, for example, it will be misused. If technology can be only given to a person who needs it, it will not be misused.
okay.
So you could have a guy with all the gizmos around and he doesn't need it from a medical standpoint. I'm talking about medical standpoint. So if I give it to a person who actually needs it, it will never be misused. He's going to use it for getting the optimum benefit that he has. He's not looking at, making a case presentation for somebody that this can also be done.
So there is one more. I mean, a little different in terms of like what do you call a thought process as well. when it comes to people as well, like when doctors are dealing with mental health patients or anybody who's actually coming, is there a difference in terms of what the divide is between what's happening with the newer doctors or more recent? Because in a very socially adaptable world of today, like how you mentioned, I'm sure the doctors are also very different in terms of what they do. So do you see a lot of
I see a lot of difference in the new age doctors because they are also coming from the same, they go through the same filters, you know. So it's not that they are coming from a different region altogether. They go through the same filters that all youngsters go through. And what I see is that a lot more younger age doctors want to be there on social media. And why, I still don't know. I still don't know that a lot of young doctors want to be digital creators also. I don't know whether being there on social media, doing things which are not linked to the medical profession per se, helps them in any ways. I really don't know. But a lot more younger people are there on social media and spending more time on doing things for social media than seeing patients or learning and doing what a doctor is ideally supposed to be doing. So there is a little bit of, I would say, disruption in their mind as well, and which is there in across the whole generation. So a young doctor is not going to be, not affected by this or immune to that social media rage. So, but I think that we need to. I'm not saying you should not be on social media, but you don't need to be a digital creator on social media. That's what I feel that
right?
because then because people come to you for solutions. You don't go to people.
But do you not think then in that case, when they are doing something like this, then it is also some level of expansion and providing public service? Say, for example, now when people are consuming a lot of content, right? So if they're consuming a lot of content, if they actually find someone like a doctor, say like you, who's possibly really good at social media and would be really giving precise information and pinpointing.
As far as the information is medically required for people at large, no problems. I'm not saying that do not educate people largely on social media. Don't do other digital things which people at your age would be doing. That's what I'm saying. That don't do things which are not right to be done by a doctor on social media. If you're educating a patient, you're doing an educative seminar for patients, you're giving them tips on social media, fantastic. Go ahead, do it. I'm not saying that's wrong. That's perfect to be doing it. That's how you reach a larger audience, no doubt about it. But don't do other things which a lot of digital creators keep doing. That's not what you're supposed to do.
Are you seeing also a very different behavioral approach towards what a mental patient or just patient in general will go from a younger patient to someone who's a more experienced doctor?
No, no,
Like,
come back. I didn't get you.
so for example, say if I'm someone who's actually having a mental challenge, or say I'm going through depression, and my approach towards what possibly will be towards a more younger generation doctor, possibly of my age, will be a far more lucid approach towards tackling my problem rather than someone who's a lot more experienced
I,
doctor.
one, you called yourself young, which I object to completely. You are no longer young, but I think see it all depends on how fine tuned or you have tuned your skills. A young guy may be absolutely fantastic in his practical approach, and an older senior guy may have just given up on all that he had learned. So, whether the person is young or old has no bearing on what his approach is going to be. So, a younger man, just because he's a younger doctor and he's seen these problems in his growing up, doesn't make him adept at handling it. Similarly, an older senior doctor, because he's seen everything, doesn't make him also good. He has to adapt. Both have to adapt. So I think in a doctor's life, you have to adopt, adapt, and learn always. So a younger doctor, if he learned the right skills, absolutely, he's far better than a senior doctor who has who has almost given up on everything. So the approach will not, sometimes the younger crowd or the younger patient likes a younger doctor because he talks to them in that. The format of talking, format of conversation, greetings are similar. Okay, and as compared to a senior doctor who will have a sort of a wheel there, and he will not go beyond a particular thing. So it depends on what you're going there for, and it also depends, at the end, you're not going there for an experience. You're going there for treatment. That's the crux there. If you get better, young, old hands doesn't matter. You have to get better. The crux is there. You have to get better there.
Right. Just one sign-off question. How alarming or big do you think the possibility of having mental stress or mental health problems can or will be over the next 5 years?
I think we are already exploding in India. And world over there are problems, but I think in India it's plenty because our population is plenty. So a lot of people in parts of the world are depressed because there's no actual interaction with people. They're not interacting people. They see humans once in 3 days. They are working from home and they hardly go out, and that leads to depression and stuff like that. But in India, there's so much of overwhelming information that there is a race against time. There are pressures in people, and that itself is very alarming a situation, and that is leading to a lot of wrong behaviors. That's leading to a lot of non-communicable disorders with diabetes, obesity, cancer, hypertension, cholesterol problems being right up there, and that is going to drive a lot of deaths in our country, premature deaths in our country. So the trigger could be all these things. We are looking at the end point where a person is diagnosed with hypertension or cancer, but probably there was a lot of things at the back end where the stress led him to do a lot of things wrong, which led him to this. So it is already exploding, I would say imploding in India, and there needs to be a very serious effort to, I wouldn't say slow down in life, but to get a sort of balance. You can do effective work and have an effective work-life balance. Doesn't mean that if you are working 14 hours a day, you are effectively working well. You can do that in the next 6 to 7 hours as well. And that's what you should be doing. There has to be a good work-life balance. And that is not happening. And that is not happening because there's pressure right from the top. If that pressure doesn't come, and pressure means that you have to keep doing the same things over and again. So there needs to be a refinement and restructuring of many things and repurposing of what you're doing. There are a lot of people I know in my industry who just keep making PowerPoint presentations and then they are never used. For years together they are doing the same, and they're made to do the same, and which are never actually made use of. So there are things that we need to make sure that whatever you do, at the end there is an analysis to it, and there's an end game and a game plan for it. You're just making people do a lot of work. Whether that work is effectively put into practice is not happening.
Right. But you say about work-life balance. Now, there's a very fascinating quote, I think, by Shah Rukh Khan, where he actually says that people who talk about work-life balance usually are people who don't have much to do, because he believes, I could be wrong in terms of like misquoting it a little bit here and there, but he says that usually, like for example, if I'm not mistaken, I think he works like maybe like 17 or 16 or 18 hours a day, and he's like, and I still can possibly work more. So. What do you think that's also a school of thought?
I don't know whether I'll be taken to court for it, but I'm sure he works like that for maybe 60 days a year. There are people who work like that 360 days a year, which is not going to. So you can never have a work-life balance if you work 17 hours a day, 360 days a year. And that's where the problem is, that you may have some parts of the year where you may have to work harder, but there may be some parts of the year where you may not need to work so hard, and that needs to be given. And as we have maternity leaves, paternity leaves are there. I think we need to give people, if they're under stress, they need to give them some relief from their stress, if work is their stress. And majority of the people who complain to us, work is their stress. It is all about work. 70-75% have work related stress, professional stresses, rather than marriage or interpersonal or relationship or anything like that. Even from an economic standpoint, it's
Right.
majority have professional stresses only.
But how do you I would say, how do you navigate, but how do you essentially identify then what are those factors which are actually giving you stress at work? I mean, I'm sure that bosses are one of them, but are there like a range of factors when you say like 70% of the people do that?
So again, Bhavya, it is like the 4-year-old, 5-year-olds we spoke about. There's a ranking at work.
Right.
Every place there's a ranking mechanism here, and if you're not ranked up, so whether the rank is based on sales or whether the rank, whatever, there's a ranking mechanism. If you're not ranked up, then you're not good enough. So that is continuing right from there. It is going. You think that when you finish your post graduation, the ranking is over. The ranking is all through. Like people ask us, who's the best doctor for XYZ problem? What is that? Means who am I to say, or who is any organization or association to rank somebody like that? Who's the number one here? Who's the best doctor for cardiovascular diseases in India? I want to go to who ranks them? So you understand. So there's a ranking which happens all through. So you can't shy away from it, and that is what needs to change. So that is what can change only if you do a lot of focused activity. Only if you know that this person ka itna hai potential, you make him do only this much. By putting extra work on that man, you're giving him extra stress. And finally, what is happening? If you look at the overall thing, what is happening is people are having health related problems. Okay, they are going to more doctors. They're spending more out of pocket on their healthcare expenditure, and they will go away prematurely. How does that help? I'm sure when we look at what are the best countries which make you happy, India doesn't rank up there. Will not rank up there, because there is this ranking everywhere for us, and we need to be up there. We are competing on a daily basis. I don't know whether we are competitive by nature, but we are competing on a daily basis, and unless that changes, that can change only when the whole structure changes.
Yeah.
If you're non-competitive and you put to the corner of the room all the time, then you better be competitive. So if things need to change there.
Yeah, I think I also have a similar theory which I tell my team, and I've spoken to some of them about this. I think this is what my thought process is. I think primarily in our nature we are like that. It's because we come from a very poor country. I mean, I could be wrong, but
You're right.
because everything from the beginning, when we started developing from after the rule, we then started that, okay, you know what, now we need to move up. So which means from a sort of a slavery sort of a scenario, we came into basically independence, then started the whole race about trying to get rich. To do that, then you obviously need to do well in school, you need to be well educated. Then if you're well educated, you will obviously get a better family, a better wife, a better life. So everything. Then when you pass out of school, then it's about getting that best job or getting into your IITs, RIMs, which means again, you have to basically come in the top 100 to do that. And then after that, it's about placements, and that continues throughout life.
Exactly. That continues throughout life. And somewhere you have faltered and you didn't get an IIM, IIT when you did and that's going to be looked down upon you all through your life. So have you heard of anybody in India who says that I finished my 10th standard and now I am going on a sabbatical for a year. I just finished my graduation and I thought that 2 years I'll just roam the world.
Break, yeah.
Have you heard of anybody doing that in India? Nobody. Are you crazy? 2 years you're going to roam the world? No way. You're going to get into post graduation 3 months later. That's what it is.
Great. Very interesting, Doctor. As usual, always super fun to have a conversation with you. And I think what's interesting is that we just didn't discuss about mental health. I think we discussed about so many other things as well, which I think have a direct relation to mental health as well, because somewhere they're contributing factors to these things. So it was really a good conversation. I hope you enjoyed this one as well.
Oh yeah, I enjoyed a lot, Bhavya, and yes, we didn't speak about mental health per se, but I think there are a lot of things around mental health which actually affects mental health, and all those things, if we are able to take care of, the mental health of the nation will be better, hopefully.
Great. Thanks.
Great.
Thank you so much.
Thank you so much, Bhavya. Thank you.